From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. If you've ever caught yourself hunched over your phone or rubbing your neck after a long day at your desk, you're not alone. Tech neck is real, and it's affecting more people than ever. Today, we're joined by Dr. Elizabeth Hoefer, an upper cervical chiropractor and owner of Well-Connected Chiropractic. Dr. Hoefer is a nationally recognized expert in the Blair technique, a precise, gentle chiropractic technique that focuses on alignment at the top of the spine. Whether you're dealing with chronic neck tension, stiffness, or just want to feel better at your desk, this episode has your back. Or, well, your neck. Dr. Hoefer, welcome to the Care Experts podcast. I'm so happy to have you here today.
Thank you for having me.
We're going to talk a little bit about something that is affecting a lot of people right now, tech neck, back pain. What is going on right now in the world that has so many people experiencing back pain or discomfort or tightness in their muscles, especially in the upper back?
Well, I think you nailed it with the conversation, tech neck, and it's because we just stare at this device in our hand more hours than we should every single day.
What are some signs that you may be struggling with tech neck? Because you just mentioned a lot of times people will come in and they don't realize that's what's causing it. But what are some of the symptoms that someone might notice?
I think that probably what people will notice is just tension in their traps. They get headaches. They have brain fog. Their neck feels tight, or they wake up from a night's sleep and they don't feel rested.
Is there anything other than our posture on our phone that could be impacting those things?
Absolutely. Not getting good sleep, having a poor sleep position. A lot of people tend to sleep on their stomachs with their head turned because their necks are literally going the wrong direction because they spend so much time in this position.
When you just did that, you pretended to look at your phone or your hand phone, your head moved forward slightly.
Yep.
What's the impact of even just moving your head forward an inch or two on the rest of your spine and your core stability? Like, does it almost feels like it shouldn't really matter.
It's so interesting that you bring that up because there is actual data and science and lots of papers that talk about the fact that you have 1 inch of forward head posture. It's as if you're adding 10 additional pounds of gravity to your body. So you do 1 inch forward and all of a sudden it's like your head weighs an additional 10 pounds.
Wow.
So can you imagine if you're like this or you're doing this and you're walking and you're just kind of hunched over, you're not paying attention to any of your surroundings. How many videos have we seen on TikTok where somebody runs into a pole because they weren't looking because they were so engrossed in what was happening on the screen in their hand?
Yes.
It's wild.
What are some indications that someone may have a neck problem?
You know, even before pain can happen, a lot of times people notice that all of a sudden they can't turn their head. And they have to kind of turn their entire body to look over their shoulder to, change lanes while driving.
Yes.
Or they go to reach for something and they can't raise their arm above, their waist or whatever. Yeah. And so movement is often the first sign, and then pain will come. Pain is interesting. Like I said, it's an indicator, but it also isn't the first indicator most of the time. Now, if you have an injury and you doing a sport and you trip or fall or whatever the case may be, you could have instant pain. And then you're like, oh my gosh, my neck is sore, whatever. But a lot of times it's more of a functional problem, and then the pain will show up because it's like, hi, we have a problem. You aren't paying attention. So
really looking at that range of motion in the body as an early indicator.
Absolutely.
Love that. Can something like tech neck or back pain be reversed, or is it generally about managing the symptoms?
Every single day in my practice, I get to take care of people who come in with tech neck and low back pain and sciatica and all the things we've discussed. And it does get better. The structure does change. The stability happens and neurological integrity is achieved. But again, maintaining that is only achieved by checking with the chiropractor to make sure that you're intact, right?
Right.
So we want to have regular maintenance care. And obviously, over time, you don't have to be in as much because muscle memory and different neurological integrity, things happen so that we have the ability to stand taller and hold our posture better. In the beginning, we see people a little bit more often because it takes 6 to 8 weeks to develop those neural pathways.
Okay.
And after we've developed them and we've maintained them, then it's easier to hold.
So you're not only going to a chiropractor if you have muscle tension or back pain. You could also go if you're noticing things like brain fog, dizziness. What other things?
50% of my practice are people that are just so stressed out because we live in a very, very busy world.
Yes.
They come in and they get their checkup, and whether they get an upper cervical correction or not, they're getting a tune-up of their nervous system, and we're having the stress be reduced, and then they're functioning better. So they're able to sleep, they're able to have better communications with their family, they're able to have that dream and wonder, because if you're stressed out all the time, you can't think past the next 5 minutes.
You're in survival mode. Wow. Okay. So I want to talk a little bit about some of the everyday things that people are doing, some of the habits that they may have that could be impacting their alignment that we could just bring some awareness to. So what are some of the main things that you're talking to your clients about?
Well, our conversation started with the phone, right?
Yes.
The device in our hand, whether it's an iPad or a cell phone or even a tablet, they create a tremendous amount of stress. The blue light coming in through our eyes affects our nervous system, the position that we stay in, and we don't even realize it.
Right.
Yeah, it's interesting.
So the phone, being aware of how often you're on the phone, noticing how often you get kind of sidetracked or called to go look at that notification that's pinging.
Yes.
What about sleep and the position that you're lying in at night?
Yeah, sleeping either on your back or on your side in a position where your neck is neutral. So you don't want to be an extension. You don't want to have your head flex. And if you're on your side, you don't want to have your hand above your head like this. Putting a kink into the position of your neck overnight, that's awful. And if let's say you get 6 hours of sleep, because most people don't, 6 to 8 hours is ideal, right? Even if you do that for 4 hours, can you imagine how fatigued those muscles are going to feel? When you wake up in the morning, you feel less rested than when you probably passed out on your pillow the night before.
Yes. Wait, I'm a stomach sleeper with my hand up and one leg up.
Yeah.
So what is, I mean, I've tried because I've heard this before for many reasons.
Yeah.
But it's really difficult to change your sleeping pattern. Do you
It
have any
is.
tips for somebody who's listening?
I have these conversations on the regular.
Yeah.
So I advocate for having a body pillow that mimics as if you're on your stomach. And it's almost like you're cuddling, with something that gives you that feedback.
Right.
And a body pillow is really helpful, but also just getting in to see a chiropractor so that they can give you an alignment. And then naturally your body will want to sleep in a position that's supportive.
Interesting.
So when you go into alignment and you get under care and it's a regular, thing where your nervous system is getting checked and getting regulated, your body will naturally want to sleep on its side or naturally want to sleep on its back. I see it all the time. People's postures are horrendous when they come in. We actually measure every single person, every single new patient. And each visit we measure their posture so that we know, like, how are you translating gravity? What effect has the last week or 2 weeks had on your nervous system? And so we test that by looking at posture, and then we do things to mitigate the stress.
What's so interesting about posture is that it requires a significant amount of awareness and consciousness to sit up straight. I mean, even the two of us right now are a bit aware of our posture.
Absolutely.
And I know that there are times when I'll sit down and I'm like, I'm going to really work on my posture while I'm at my computer today. But the moment I'm not focused on it, I go back to whatever position is most comfortable.
Yes.
What are some ways that people can support improved posture over an extended period of time?
That's a great question. I was going to say the second thing, because we were talking about devices. The second thing would be probably like how your work setup is.
Right.
So making sure that when you're at your desk, it's dynamic. You can stand up, you can sit down. And if that's not a possibility, do your very best to have support in the chair that you're sitting in, making sure you're not turned to the side, looking at the screen in this direction, straight on, and making sure that your eyes are looking level at the screen. All of these things are really important to diminish the stress that is constantly being put into your system. Another really cool hack that I learned from my dear friend Roland many years ago is this thing called the Pomodoro technique.
Okay.
And it is this neurological hack that essentially you work for 25 minutes. You literally set a timer, but the timer is across the room. So unless you get up and move, the timer's going to beep at you annoyingly until it's done. So you set a timer, 25 minutes, and then you physically have to get up, and for 5 minutes you do something completely different than what you were doing. Because number one, it gives your brain a break.
Yeah.
Number two, it gets you up and moving, because how many times, and I'm guilty of this too, if I'm doing an analysis or several sets of analysis on a CBCT, it's been an hour and a half before I've even moved my body.
Right.
Because you're so engrossed in the task that you're doing because you want to get it done. That's terrible for your neurology. So even I need to set a timer and get up and move. Okay. So the Pomodoro technique is 25 minutes on with intense activity, 5 minutes doing something completely different than what you were just doing.
Oh, I love this.
Yeah.
Everybody grab your phone right
Yes.
now. Set a timer for 25 minutes.
Yeah.
There's no better time to start
than right now. Exactly.
And then after that 5 minutes, when you go to sit down again, you're going to set your alarm for another 25 minutes.
That's right. And it's so incredible. And it's actually proven scientifically that you'll be more productive. You will get more done. Even though you're having these interruptions, your brain physically needs a break. So it's good.
So we've talked a little bit about sleep. We've talked about using your devices and your phone. We've talked about our work setup. Are there any other places where people are spending a lot of time, they may have a habit that could be harmful to their back?
Yeah, I would say probably like when they get home and they just sink into the couch, and there's nothing wrong with relaxing, but make sure you're doing it supported. Also driving in a car. A lot of advice I give is just kind of like, do you have support in your lumbar spine? I even tell people, roll up a sweatshirt, get a travel pillow, something, because the lumbar supports in most cars aren't enough and they're not designed to fit everybody, right? So if you have your own thing, a sweatshirt, a blanket, a pillow, and you can just stick it in the small of your back, it instantly allows you to sit up with support and you're not thinking about it. And as you said earlier, we're very mindful of our posture right now, but the minute that we stop thinking about it, we immediately sink back into the preset that our nervous system's comfortable with, because at any given moment, we're expending a ridiculous amount of energy to stay focused and to function. And any sacrifice of energy is too much for the body. So it's going to reset to the least energy output possible. Right. But if you're in alignment and your brain and body are connected effectively, especially at the top of the neck, where all of those resources and primal things come from, the brainstem, then you preserve energy and you have more effective use of your energy.
How does somebody know if they have just, a kink in their back, or they have tension that pops up every once in a while? How do they know when it's time to go in to see a chiropractor versus just letting the body figure itself out?
Sure. It's interesting with pain signals. Pain is a signal. It doesn't mean it's good. It doesn't mean it's bad. It just means that it should be looked at. Okay. And so when people feel pain, that would be an awesome indicator. However, after a while, the body says, you're not paying attention. I'm just going to turn that signal off. Because again, it's a resource that isn't being addressed. And it's like, you're not listening. I'm just going to shut it off. So people, or they hide it. They mask it with over-the-counter pain relief or whatever. And so, just making sure that you're paying attention to the cues that your body's saying. And if you're a little bit disconnected from that, just simply looking in the mirror. Is one shoulder significantly higher? Do you notice that a pant leg has to be hemmed in a different level?
Right.
Right?
Really? Is that a thing?
It's
that
a
will
thing.
happen?
Absolutely.
I like what you said about listening to the body, and that if you ignore the body for long enough, that pain may start to dissipate or go away. But generally what I find in that situation is that the body speaks to you in a different way. So all of a sudden you start noticing, oh, I've got anxiety, or I'm not able to focus, or my brain fog is more present, or I've got now hip pain. Shows up different in a different spot in the body. That's right. And so I love that you mentioned earlier that chiropractors aren't just working with pain. It can be all these other neurological symptoms as well.
Absolutely, yeah.
What does a typical chiropractic session treatment plan look like? What would somebody expect?
Well, every chiropractor is different, and we all have a basis of education and a basis of like how we're going to look at the spine, but there's chiropractors that do nutrition, and there's chiropractors that just focus on sports. In an upper cervical practice like what I do, the foundation is always making sure that the neck is in alignment, and we do that by imaging and neurological and orthopedic examination. And we really get a good idea on what structural issue is likely causing the neurological deficit.
Okay. And so they're coming in for their initial assessment and going through some of this imaging. You're doing a scan yourself with your eyes, your hands, as an expert in this area.
Correct.
And then do we always need a follow-up session, or is it just case by case?
Every case is different. Every body is different. That's why I'm really an advocate of taking x-rays, because you're not going to have the same spine as anybody else, because nobody else has had your life and the traumas that you've experienced. So every body presents differently, and being able to have a blueprint, I call it like the Matterport of the spine. You know how when you get like a 3D tour of a house that you're interested in buying, and you can look at each room because the camera's gone in and give you the Matterport?
Yeah.
Our cone beam CT 3D x-ray is the Matterport of the spine, and it gives me a virtual tour of what your structure is doing, and then I know exactly how to put it back together. So there's no question. And the other neat thing about the Blair upper cervical technique that I get to practice is that there's no twisting, there's no popping, there's no cracking of the neck. And so that's a differentiator in what I do compared to traditional chiropractic. But the truth is, traditional chiropractic is effective and it does work.
I love that. Now, once you've adjusted somebody or used the Blair technique, as you mentioned, can exercise or things like Pilates or yoga help strengthen the core or muscles to then support that alignment, that new alignment?
Absolutely.
Okay.
Pilates is amazing for core.
Yeah.
Yoga's phenomenal for strength, vitality, and even mental health, because there's so much breath work involved. And breathing in and of itself is a simple exercise that you can do to stimulate your vagus nerve.
Yeah.
And so if you're overwhelmed and having anxiety and you can't get to the chiropractor, you know, because they're booked or you're far away or whatever the case is, you literally can just do some breath work to help stimulate your vagus nerve to get you through until you can get your body to the table.
Amazing. I have some awesome Ask Me Anything questions
Okay.
from our audience for
Okay.
you. The first one is, my shoulders are hunching over more and more. Have you seen success with your patients using a back brace or posture correcting bra?
Yes, there are amazing products out on the market where people that I know that work in our industry have invented things that are supportive. The truth is, they're only as good as the structure that they support. So if we can get you into alignment and then we can put you in a posture supporting shirt or bra, it's going to support the body to then recover and heal. It's kind of like doing rehab. PT is amazing, but if you do PT on a broken system, you're going to get broken system.
Right.
If you do PT on a system that's neurologically and structurally intact, PT is going to thrive. So,
And when you say PT, physical therapy?
Right, physical therapy,
great,
right.
Great. Do you have any recommendations on exercises that I can do during the day at my desk between chiropractic appointments?
So we talked about the Pomodoro technique, and it's not an exercise, but it's a habit.
It's a hack.
It's a hack. A great exercise, and I teach this to my patients, is putting your hands behind your back.
Yep.
You're going to put your hand around your wrist and you're going to distract your shoulder. So you're going to kind of pull your shoulder to the opposite side.
Oh, that feels
and then
good.
It does feel good. And then I want you to just tip your head to the side that you're pulling your wrist towards. So opposite of the shoulder that you're distracting.
Okay.
And those are stretching your scalenes. Your scalenes are muscles that come from your neck and they attach to the first rib, and they are absolutely indicative of mobility in your neck and stress. So a lot of times I'm doing trigger point work on the scalenes if you're holding your upper cervical correction, but you can do a scalene stretch and help to get movement and mobility there. I'm not a huge fan of putting your hand on your head and pushing and pulling, because you can actually hurt your neck by doing that. Sometimes I think we're stronger than we realize, but if you just do a gentle stretch and distraction, that's oftentimes a lot better.
I feel like we all grew up playing sports and pulling our neck to the side like that. So
Yeah.
I love that you just clarify.
Yes.
You don't need your hand to be pulling. You can
Not
just
at all.
use
Yeah, just use your neck
Tip
and
the
head and-
ear down to the shoulder. Close your eyes. Take a couple of deep breaths and do that.
Absolutely.
Agree.
And as you breathe into it, you'll feel your body go a little bit farther, and that's a good thing. That's also could be a little test. Like if you can only tip your head this far on the right side, but you can go a lot farther on the left, that could be an indication that there's a problem in the structure and the anatomy of your neck that you might want to have a chiropractor look at.
I mean, I am just realizing how out of alignment I am over here. If anyone else is feeling the same thing, you're not alone.
Right?
The last question, my neck pain is always worse on one side. Could that mean something's out of alignment?
Yes, ma'am. Yep, we just talked about that. So asymmetry is the rule, especially in structure with the Blair technique. But asymmetry in muscle tension, asymmetry in posture, asymmetry in function. If you can move your right shoulder and do the entire range of motion, but you can only lift your arm this far on the left, that's a problem. So we want to be able to have full function and full mobility. And so if there's asymmetry from one side or the other, or you notice a lot different tension and stiffness from one side to the other, definitely an indication that you should get your nervous system checked.
Amazing. Well, thank you so much for joining us today on the podcast. It was a pleasure to have you here.
Thanks for having me. It was a great conversation.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.